Hello, everyone. Thank you for joining again. And today we are going to start a new part of the brain. And today our topic is cerebellum. And in this cerebellum, this is a two-part series. The very first part, we are going to discuss the functions, the lobes, hemispheres, peduncles, cerebellar regions, and the blood supply of the cerebellum. So, what is a cerebellum? So, cerebellum is the part of the brain which is located in the posterior cranial fossa, and it is situated dorsal to the pons and the midbrain. So, it is a Latin for a little brain. So, it is tucked away under the cerebral hemisphere. So, this is the cerebral hemisphere is the bigger one. The little brain is the cerebellum, and it consists of two hemisphere which is connected in the middle by the vermis and has three lobes. And again, it has a cortex. Made up of from gray matter, same as the cerebral cortex, and there are three peduncles that link the cerebellum to the brainstem and diencephalon, and again it forms the roof of the fourth ventricle. So what are the functions? So there's four or five basic functions that the cerebellum has to modify or has to look after. The very first one is the modification of the motor output. Then it helps with the maintenance of balance and posture. It also helps in the coordination of voluntary movements. It helps with motor learning. So if you want to learn tying the shoes or bicycle riding, etc., it helps with that. It helps with the motor learning, and finally it helps with the cognitive learning as well. So let's look at the anatomical overview of the cerebellum. So again, it is present in the posterior cranial fossa, and it forms the roof of the fourth ventricle. Now there is like a sagittal view that you're looking here. So it has two hemispheres, and each hemisphere has three lobes, and there's three peduncles which are paired bilaterally. Cerebellum has the anterior, posterior, and flocculonodular lobe. Sorry, it's a mouthful. So look here, it's an anterior lobe right here. This is the posterior lobe, which is a bigger one, and the flocculonodular lobe is right here. It's a very small structures, and the three peduncles that connect the cerebellum is the middle cerebellar peduncle, inferior cerebellar peduncle, and the superior cerebellar peduncle. We're going to look that in details in the coming slides. Again, this is the anterior view of the cerebellum. So over here, you can appreciate better on bilateral side. So this is the anterior lobe right here. Posterior lobe is the biggest one, and these small structures right here is the flocculonodular lobe. The vermis is the midline that actually connects both sides. So let's start with the hemispheres or the zones of the cerebellum. The very first one we're going to look at is the vermis. So this one is involved in the control of the axial and the proximal limb musculature. So over here, look at this midline. This is the vermis. So this one right here is involved in the control of axial and the proximal limb musculature. So what will happen if there is a lesion in this area? So that will cause the ataxia of the trunk. That's important. Now, patient will sway away with the eyes open. If there is a lesion present here, the patient will sway away with their eyes open. So probably there's a problem with the balance. So it is due to the proximal limb musculature inhibition. So what will happen is, so if there is a chronic alcoholics, they have a thiamine deficiency, which in a long run will cause the degeneration or loss of Purkinje cell populations. Again, we're going to look at the Purkinje cell population in the later slides. This damage will cause the vermis to get damaged, and mostly the superior aspect of the vermis get damaged. So that will cause the proximal limb musculature inhibition, causing the ataxia of the trunk. The second one is the intermediate hemispheres, or it is also called as the paravermis. So you look right here. So if you look at, this is the midline vermis, paravermis, like beside vermis on either side, and it controls the distal musculature. So the more central you are, the more central musculature you're controlling, or if you go away, it's going to be a distal one. So paravermis actually controls the distal musculature, and if there is a lesion that is present here, there will be a inhibition of the distal musculature control. Then we have the final zone, and this is the largest of all the hemispheres, and this is called the lateral hemisphere right here. So it is involved in the motor planning, and this lesion will in this area, which also sometimes include the intermediate hemisphere or paravermis. It could be caused by a stroke or a tumor, and the symptoms are going to be very big. So there's going to be ataxia of the extremities. There's going to be intentional tremor. nystagmus, dysmetria. Dysmetria is important because the patient is going to have an inability to judge the distance between the hand and the object. Then there's going to be hypotonia. As it said, tonia means tone, hypo means less. So there's going to be decreased muscle tone, and then we're going to have a weak, deep tendon reflexes. So now let's look at the lobes of the cerebellum. Again, remind yourself there's going to be three lobes in cerebellum. There's going to be anterior lobe, which is not as big as the posterior lobe, and the smallest one is the floculonodular lobe. So let's start with the anterior lobe. So anterior lobe receives the input primarily from the spinal cord, and it is separated from the posterior lobe by the primary fissure. Primary fissure is right here, and it is connected with the contralateral anterior lobe by the midline vermis. Again, if this is the lateral part of it, so if you look at from the anterior, you're going to see a vermis in the midline. We have seen that in the different zones that we studied in the slides before. So it is connected with the anterior lobe by the midline vermis. Then we have the posterior lobe, and this is the largest of all the lobes. So it receives the input from the brainstem and the cerebral cortex, and it is separated from the floculonodular lobe by the posterior lateral fissure. Posterior lateral fissure is right here. We have the primary fissure right here, and then this one, posterior lateral fissure. And this is connected with the contralateral posterior lobe by the midline vermis. So again, anterior and posterior lobes are connected with each other by the midline vermis. The last one is the floculonodular lobe, and it receives the input from the vestibular nuclei. It is the smallest of all three lobes, and it lies superior to the anterior aspect of the posterior lobe. I know it's a mouthful, but it lies superior to the anterior aspect of the posterior lobe and inferior to the anterior lobe and posterior to the brainstem. So it's like right in the middle of all the lobes. So basically, that's what you should remember. It is united with the contralateral floculonodular lobe by the midline vermis again. So midline vermis is basically a connection between both lobes. The next one is going to be the peduncles. So the peduncles, as we discussed before, there's three of them. There's a superior peduncle, there's a middle peduncle, and the inferior peduncle. So we're going to start with the superior cerebellar peduncle. So peduncle actually are the gateways where the afferent and efferent fibers from different part of the brains and body that actually enter into the cerebellum. So we have the superior peduncle right here, this blue structure that you can see. This is the superior cerebellar peduncle. It contains the afferent and efferent fibers which are engaged in the motor control. So now it will connect by this peduncle. It will connect the cerebellum to the midbrain and thalamus, and it is located superior to the other peduncle. So of course the name suggests so. The second one we're going to look at is the inferior cerebellar peduncle. You see this red structure right here. This is the inferior peduncle. It consists again from the afferent and efferent fibers that carry proprioceptive information to and from the body and the vestibular system. And it connects the cerebellum to the medulla oblongata and the spinal cord. And it is located medial to the middle peduncle. So it is more medial to the middle peduncle. The last one is the middle cerebellar peduncle. So this is the middle, this greenish structure that you see here is the middle peduncle. It conveys information about the voluntary motor activities. Then it connects the cerebellar cortex to the contralateral basal pontine nucleus. It is located more laterally, and it is the largest among all the peduncles. Now, based on the functions and internal connections, cerebellum is divided into three different regions. One is the vestibulocerebellum, the second one is the spinocerebellum, and the last one we're going to discuss in the last slide. So the first one is the vestibulocerebellum. It receives its input from the vestibular nerve. So that the afferent input that's coming into the vestibulocerebellum, or the connection, is through the vestibular nerve. The output is from the cerebellovestibular tract, vestibular nucleus, and the spinal cord, because since this basic functions of the cerebellum is to modify the input that it's receiving, so it's going to be translated back to the different regions of the brain, so it modify and it send it out. So what are the functions? So function of the vestibular cerebellum is the maintenance of posture and the vestibular reflexes. So you look here, this region right here, which includes the nodulus and flocculus, flocculonodular lobe, this is basically the vestibulocerebellum. The second one is the spinocerebellum. So it received the input from the spinocerebellar tract. The output goes out to the reticular formation, red nucleus, and the spinal cord. Again, very important functions, and these are integration of the sensory input with the motor output. So what you're receiving, again, modifying, relaying, understanding, translating, it's gonna integrate that sensory input with the motor output, and it will also functions with the adaptive coordination of muscle movements. So you get an information. So for example, you touch something, so there's a sense information relaying into your cerebellum, or the motor output is going to tell you like to remove the hand or place your hand over there. The last one is the pontocerebellum or cerebellum. So this is the largest part of the cerebellum when it comes down to the connections. This is the most lateral part. It receives the input from the pontocerebellar tract. The output goes to thalamic nuclei. So which thalamic nuclei? I've used abbreviation. We have discussed that before in thalamus slides. Ventral anterior, and the ventral lateral thalamic nuclei are involved in it. It will give out the output to the cortex and to the spinal cord. This will allow the functions for the timing and planning of the movements, and will also help with the cognition. So in the final slide, we're going to look at the cerebellum blood supply. So if you remember the circle of Willis, that is important over here. So you look at the vertebral artery, remind yourself, vertebral arteries are the paired arteries. They come up here and then they combine to make a basilar artery. So the very first branch that it gives off is the posterior inferior cerebellar artery. You go up, you give out the anterior inferior cerebellar artery, and when you go further up, uh, making the villus, a circle of villus, you make the superior cerebellar artery. So these are the three major arteries that actually supply. So this greenish color right here is the anterior lobe, this is the posterior lobe, and this is the flocculonodular lobe. So with this slide, we're going to end our presentation. This is the part one of the cerebellum. In the next slides, we have further much more to discuss with the internal structure, the layers of the cerebellum, and then we're also going to look at the internal circuitry with the afferent and efferent fibers. So stay tuned, and I'll see you soon. Thank you.